Hi everyone, my name is Francis Chikawanda and I will take you through diastolic dysfunction assessment. In this presentation, I will focus on pseudonormalization, which is also known as grade 2 diastolic dysfunction. Now, to assess the level of your knowledge, we will have a small quiz. And the first question is, explain diastolic dysfunction. The second question is, how is diastolic dysfunction diagnosed? And the last question is, mention 4 grades of diastolic dysfunction. If you have answered all questions, let us now have a case study. Client J has shortness of breath, increased heart rate, LA volume index greater than 34 mils, and TR velocity greater than 2.8 meters per second. Study carefully the following results that were obtained after doing post-wave Doppler and tissue Doppler imaging to determine whether client J has diastolic dysfunction or not. Use the 2D image, the table, and the algorithms provided where necessary. When we did systolic function assessment, we found that EF was normal, it was 70%. And when we did post-wave Doppler, we found that E velocity was measuring 85 centimeters per second, and A velocity was measuring 82 centimeters per second. E to A ratio was 1.08, which is normal. But now when we look at E wave and A wave, we saw that they are almost the same. So here we suspect grade 2 diastolic dysfunction or pseudonormal. But also E velocity, there is a slight delayed relaxation. Now on tissue Doppler, we saw that mitral annular velocity pattern is reversed. So normally E prime is supposed to be greater than A prime. So E prime is the first wave and A prime the second wave. So when we measured the first wave, which is E prime, it was measuring 10 centimeters per second, which is normal. So normally it is supposed to measure greater than 7. So that is for E septal velocity. And we also measured E prime lateral velocity, and it was also normal. It was measuring 13.20 centimeters per second. Normally it is supposed to measure greater than 10 centimeters per second. So E to E prime ratio is normal, it is 7. Normally it should be less than 14. Now let us determine the grade of diastolic dysfunction. So when we look at LV relaxation, according to this table, there is delayed relaxation, so it's impaired. Left atrial pressure is increased because the left atrium is dilated according to what we have been given. E to A ratio is normal. It was measuring 1.08, which is between 0.8 to 2. And average E to E prime was 7, which is falling on grade 1. And TR velocity was greater than 2.8 according to what we have been given. And LA volume is increased. So we suspect grade 2 diastolic dysfunction. Now we go to this algorithm because we found that systolic function was normal. So according to this algorithm, we will use 4 criteria, and we see that 2 are positive and the other 2 are negative. So according to this, we cannot conclude. So we'll go to the second algorithm, and on this second algorithm, we will use 3 criteria. That is average E to E prime, TR velocity, and LA volume index. So here, 1 is negative, that is the first one, and the 2 are positive. So according to this, we can conclude that client J has grade 2 diastolic dysfunction or pseudonormal. I repeat, 1 is negative and 2 are positive. So this is pseudonormal or grade 2 diastolic dysfunction. On summary, we found that systolic function was normal, so EF was measuring between 60 to 70. E wave is greater than A wave, and E to A ratio is normal. A prime is greater than E prime, so we suspected pseudonormal or grade 2 diastolic dysfunction. E prime septal velocity is normal. It's measuring 10 centimeters per second, and normally it should measure greater than 7 centimeters per second. A prime lateral velocity is normal. It's measuring 13 centimeters per second. Normally it is supposed to measure greater than 10 centimeters per second. E to E prime septal is normal. Normally it is supposed to measure less than 15. When it is greater than 15, it's abnormal. So here it's normal. It is measuring 8. And E to E lateral ratio is normal. It's measuring 6. Normally it should measure less than 13. And E to E prime, average E to E prime ratio is normal. Here it is measuring 7.49. Normally it is supposed to measure less than 14. When it is measured greater than 14, it's abnormal. And LA is not normal, and also TR velocity is not normal. So according to our findings, or according to the results, we can conclude that client J has grade 2 diastolic dysfunction or pseudonormalization, because when we used algorithm B, we saw that 2 criteria are positive and 1 is negative.